is going to be Dr. Brian Wheatley. Dr. Wheatley is the Associate Medical Director for Cardiothoracic and Vascular Surgery at the Carle Foundation Hospital. I got to meet him, fortunately, a couple years ago down here in Urbana, and I really appreciate you coming today and speaking. My pleasure.
Well, thanks for the invitation. I have no slides. I just will take a few minutes just to introduce myself, tell you a little bit about what I do. Like Dr. Berkowitz mentioned, I do have some administrative roles at the Carle Foundation Hospital. I'm the Associate Medical Director of Cardiothoracic and Vascular Surgery. I'm a board certified vascular surgeon. My practice is 100% clinical, so I spend all my days and nights thinking about vascular surgery. Vascular surgery, I should probably explain it because my parents don't understand what it is. Vascular surgery is the surgery of arteries and veins. Probably 90% of what I do is arterial. That includes neck surgery, carotid arteries for stroke prevention, aneurysmal disease, lower extremity, upper extremity bypasses. The venous part is about 10%, and also included in that is the work we do for dialysis patients. Probably 60 or 70% of what I do nowadays is catheter-based. That's a big change over the past 20, 25 years. Vascular surgery at a time was only incisional. You make a cut on somebody's skin and you find the artery, you fix it. Nowadays, we're puncturing arteries in different parts of the body, groin, arms, neck, wherever. We can work remotely, so it's less invasive, minimally invasive. It's a good specialty. I'm very happy with it. It's professionally very satisfying. I'll spend a little bit of time talking about kind of how I got there, but just kind of starting at the end and going forward, I've been very pleased with the work. It's extremely fulfilling. We work on very sick patients. The patients, we're often the last resort for folks. The surgeons call us when they get into bleeding. It's despite the move towards less invasive or minimally invasive work, problems still happen in the operating room. Somebody will make a hole in a big artery, and someone's got to fix it. So it's good to have that skill set. We're really the only specialty, and we're not the only ones that fix arteries. I mean, cardiologists, interventional radiologists, interventional neurologists. There's lots of people that can do it. But vascular surgery is really the only specialty that can do it all. So we do the catheter-based work in addition to the surgical work. We do a lot of medicine as well. I mean, I spent 4 years of medical school learning the same things everybody else does. A lot of our, like I said, our patients are sick, so we spend a lot of time talking about the risk factors, managing the medications. I spend maybe 20% of my time looking over ultrasonography. So it's almost like a radiology-based aspect of my profession. So the way I explain to students that come preceptor with me is, it's really kind of a four-pronged approach. There's the medical aspect. There's the non-invasive vascular lab aspect, that's ultrasound and looking at CAT scans. There's the minimally invasive or catheter-based aspect, and there's the surgical aspect. So it's a nice variety of things that I do on a daily basis. I work with residents. I'm a clinical professor here at the U of I, so we have a general surgery residency. That's a very satisfying part of my job. I work with medical students. I work with a few of you guys. Kind of my track, I did the more traditional vascular track, which was 5 years of general surgery. So I'm board certified in general surgery, but I don't do it. So it's really 5 years of my life that I don't apply much. I mean, there's a lot of skills that you learn, but I don't take out gallbladders anymore. I don't take out appendices. I used to like to do that. But it's 5 years of general surgery followed by 2 years of vascular surgery. Nowadays, you can get through it much quicker. They're kind of getting away from the fellowship and moving more towards a vascular residency. So you're not board certified in general surgery, but years as you go through this, you realize years count. And if you can cut off a couple years and still get to the same point, that's a benefit, because I was 34 years old when I started practice. That's my first real job, was 34. And I went straight through. I didn't take any time off except for a year in between undergrad and med school. So, I mean, it's a long time. It's a long track. No one really told me about that when I was starting. I mean, it's one reason why you guys are like light years ahead of where I was. I mean, I'd never sat in a lecture like this. I don't think I would change my mind, but no one really tells you that you're going to be in your early 30s by the time you really start to settle into your career. There's nothing wrong with that. You just have to be prepared to see your friends go through promotions and, you know, start families, and you're like, you know, every family gathering through residency was like, you're still doing this, you're not out yet. Plus I added on a couple of years for specialty training, but it's a long course. But I don't regret a single part. Residency was a blast. I mean, it's kind of like when you move on to the next phase, you always look back at the phase before and you're like, man, that was really fun. I mean, when you're in it, like right now you're in it, you know, college is fun, but you're like, yeah, it's work, you know, it's the phase you're in. But when you move on to med school, you look back and like, boy, those 4 years of college were just fantastic. And then the same thing, you get into residency, you look back at med school, you're like, boy, that was easy and so much fun. You get into fellowship, look back at residency. So every phase, like now, I look back at my training years, I very fondly. I wish, you know, we had those connections because it was a lot of fun. So 5 years of general, 2 years of vascular. I did med school at Southern Illinois, like Dr. Berkowitz mentioned. And then 4 years of undergrad here, I majored in biochemistry. It wasn't MCV back then, it was an LAS program. I started out in chemistry out of high school and did 1 year. I liked the chemistry part, the physics was just bananas. I mean, I couldn't handle it, so I had to switch to something. And biochemistry seemed like a nice in-between. But the biochem actually, if I could, you know, any class or series of classes that helped you for med school, I think biochem was by far one of the most helpful. I mean, there's a lot of biochemistry in medicine, especially, you know, the first and second years. I did okay in high school. You know, I did well grade-wise. It was when I got here is when I realized how much, you know, the competition is like.